All right. Hello, everyone. Welcome. Great to see young investigators from across India showing up for the third month in a row for the third huddle of young investigators across India. Promises to be really interesting. Um, I think I've said this before. The YI huddles came up from a conversation at the Young Investigator meeting in Gandhinagar, where early career researchers who huddled together there for the in-person event said, I wish we could do this throughout the year. I wish we just didn't have to do this once a year. And we said, well, we can't organize an in-person meeting more than once a year. It's a lot of work, but we can definitely try and keep it going virtually. And so that's how we actually brought this group together. Great to see people returning, great to see them filtering into the meeting room. Today, we have very kind colleagues who've given us their time to join us. Divya Kumar from JSS Medical College, Mysore, and Bernd Pulverer from EMBO. And Bernd is joining us in the middle of the day for him. So Bernd, is a good time to talk about research reproducibility. It's noon, Friday noon, where you are. Always a good time to talk about research reproducibility, I would say.
Absolutely, key topic, but yeah, we're excited.
That's great. Thank you. Thanks for joining. And as we said, it's going to be a no slides event. This is just a placeholder. It's intended to be conversational. Please raise your hand if you want us to unmute you at any point, or type your question in the chat window. And we look forward to your questions and keeping it interactive and engaging. Divya, now
Yes.
It's all yours. You can introduce Bernd and get started with the questions. Okay. Welcome, everyone.
So welcome all. As you are eagerly looking forward, we will begin the session. Before that, I'll introduce Bernd to all the participants. And again, it's always a pleasure working with India Bioscience. Undoubtedly, this is a wonderful opportunity to meet other colleagues, young investigators on this platform. So I'm going to make use of my notes because I need to tell these points on Bernd. I'm sure all of you would second that and also agree with the efforts that have been made by India Bioscience in bringing the right and eligible resource person. It's not an easy task, okay? So let me introduce Bernd. He's received his PhD from Ludwig Institute of Cancer Research, London in 1992. After his intense postdoctoral research, he has served as associate and senior editor at Nature from 1999 to 2002, and subsequently chief editor of Nature Cell Biology. And it's evident from his CV that he is associated with EMBO since a long period of time, which is European Molecular Biology Organization. He has served as the chief editor of EMBO Journal for a decade, and now is active as chief editor of EMBO Reports, and he leads the head of scientific publications in EMBO. And something which is very important that all of you should be aware of is the co-founder of San Francisco Declaration on Research Assessment, which is acronymed as DORA. If you need more information on that, I think you should go to the site and have a look at it, because the vision and the objective of DORA is amazing. He serves as the steering committee on this as well. He's a member of the advisory boards of BioArchives, Review Commons, ASM Publications, which is a boon to all the young investigators like us who are aware of the preprint services that is out available there. He is the founding director of the journal Life Science Alliance, which is co-published by EMBO Press, Rockefeller University Press, and Cold Spring Harbor Laboratory Press. So this is his brief introduction to say. Thank you, Bernd, for being with us today. It's wonderful to begin the conversation with you. So all the participants, please, like as Karishma said, unmute yourself if you have any questions, or put your questions in the chat box. We will be happy to take it as we move along with this conversation. So to begin the conversation, Bernd, on the most relevant and the hot topic, which is research reproducibility and research documentation. Why is it important? Do we really discuss about it often in the lab setting, or how should we go forward taking it?
Great. Well, first of all, welcome everyone to this discussion, and thank you very much for the invitation, Divya and Karishma. So I'm very excited to be here because also we want to listen to your views and your suggestions on how we should sort of shape the system going forward to improve it, because we're not here to put more hurdles in your way to success in science. We want to actually decrease the hurdles. And while sometimes it seems that all these extra policies and so on add add complexity and make it more difficult to publish and share science. We obviously, ultimately, the outcome is that we want to ensure that we share science properly in a more meaningful way. So to your question, Divya, I think it's important to sort of review some first principles. I mean, it should go without saying. And by the way, I was very excited to see somebody on a motorbike joining. That's great. This real commitment from everybody to be here. It's great. So I think it's important to remember briefly, although it should go without saying, that really, science works in the biosciences, especially by sharing information and by learning from each other and building on each other's work. That's the whole reason to publish information, to go to conferences. It's not, and I'm really emphasizing this because that's part of the background to the DORA declaration also. It's sort of, the publishing system has been a bit undermined or perverted to become sort of a research assessment tool. Primarily, but the real function, that's why we're here, is to share information properly. And this was really articulated super nicely by Newton already in the Age of Enlightenment, when he said, if it is that I've seen further, it is because I'm standing on the shoulders of giants. It really means I'm learning from others, I'm building on their work, and that's why I can do good work myself. And reproducibility is, of course, at the heart of this. If you can't rely on the work of others, we get misled. We invest time and finances in maybe faulty or maybe unreliable information, and that could cause massive problems. And it's not a theoretical question, because there's been multiple, you're probably all aware, there's been multiple efforts to look into this, how big a problem it is. Both at the level of self-reporting. So there's a whole bunch of different questionnaires that you can look into. And I can just quote from one. They usually come to the same conclusion, that about half the science in the biosciences in the broader biosciences that we publish, about half the papers have some issues with reproducibility. And this is amazingly, I'm quoting from a Nature survey a few years ago, where they had several 1,500 people respond. They even reported of papers they published themselves, 60% said they struggled to reproduce their own findings. And that shows there's a huge problem even at the level of self-reporting. But it's not just that, there's also formal studies that have been done. The whole topic started maybe 6-7 years ago, when the industry, so both biotech and pharma industry, actually started to report that they really struggle to reproduce basic science findings, and to the point where they were really even stopping to read these papers. And that's, of course, a real warning sign. So there was several commentaries from different very large pharma companies that reported, including Genentech, Roche, and others, Novartis, that reported they could only reproduce 50% of what they were trying to reproduce. And pharma is very rigorous in reproducing. So, that's an orthogonal input that showed exactly the same. And then we also know anecdotally from the number of corrections and so on, and going to conferences, that this really fits. And the last one I wanted to mention is that there's also a formal effort to try to see if things can be formally reproduced in an experimental way. So the Center of Open Science in the US actually set out to try to do this for cancer papers and social science papers as an experiment. And they picked 50 papers in each field and tasked very senior people in the same field to try to reproduce milestone papers. And again, it turned out very similar, that they couldn't reproduce more than half of the papers, even after exchanging with the original authors, exchanging reagents. Huge amount of effort, several $1 million went into that experiment. So, there's 3 different ways now we can see beyond the anecdotal that we have a problem. And I think it's really important to remember to really make clear that this is not a problem of research integrity per se. This is a problem in how we report information. And that's maybe where we want to go with the discussion a little bit. How can we actually do things in a more structured way going forward?
Yeah, I think at every career stage, irrespective of the career stage, I would say, be it early career, intermediate, or senior, research reproducibility is something very critical to a lab setting. And for us as a young investigator, it is challenging, because as we start our career, it's overwhelming with administration work, the lab research, and keeping in mind how important research reproducibility is. Do we have a framework that the young investigators can keep in mind or define it in their lab setting to have research reproducibility?
Yeah, exactly. I think you make a really important point, Divya, in that it kind of comes really low on the pecking order, because the incentives are really there to share science, to share exciting, innovative, novel, forward-looking science in the fastest way possible. And anything that seems to add friction to that process is sort of discouraged, essentially. So we have a really fundamental problem, and that's why we need a sort of framework here, because the funders are not incentivizing attempts to reproduce science or even to report in a reproducible way in the first place. There's no incentives. In terms of your research career, the research assessment doesn't encourage it either. So what is being counted, and this brings us again to the San Francisco Declaration, what's really primarily being counted is your journal-based output, based by journal name, by impact factor, and so on. But nobody looks into these papers. Are they actually reported in a sort of due diligence way? Were they reproducible? There's almost no funder I'm aware of that follows up on any of the work they funded. Did it turn out to be reproducible? Has it been, cited by others in a way, in a way that shows it's reproducible, and so on? So there's a systems level problem. And then, of course, at the level of the research infrastructure, we have a problem that there is no clear standards, and there's no clear platforms or mechanisms. And that's changing very fast, and it's good to discuss what is available now. And at the journal level, also, we're really still publishing in a sort of last century way, largely, which is sort of narrative-driven papers where you basically describe in free text your data that is shown typically in flattened format in a sort of PDF, pretty pictures about the data, rather than sharing proper data in a way that has metadata associated, that renders, and methods associated, and so on, that renders the data fundamentally reproducible. So that's why we need a framework, I think.
I think when research reproducibility comes into point, the first thing which runs hand in hand or parallel is documentation. If the documentation is right, it means that it is reproducible. Let's take it 90% of the time, because most of the time researchers fail in documenting the data correctly, whether it's a positive or a negative data. So before moving on to the documentation, in the audience, do you have any concerns or any questions that keeps you haunting when it comes to research reproducibility? If you have no questions, we can move further. Something that you keep thinking of when research reproducibility is asked in a lab setting. Okay, so seems like nobody is up with a question. So let's go with research documentation. What are the best practices that you would suggest to start documenting the research? Because this is something which few labs follow very stringently. I've seen labs who are very particular with research data management, which is updated on a regular basis, got it corrected or shown to the PI. But a few labs are not very particular about it. So what are the different forms of documenting the data to have it documented in the right way?
Yeah, so I'd be very interested also to get feedback from all of you on how you actually do things. So traditionally, I think one thing we've noticed from the journal vantage point that's really changed quite dramatically is when I was doing my research, we were still really pulling out primary data and in lab meetings and sharing, basically autorats and stuff in situ in lab meetings, so you could see the primary data that came out of the machines. Now this is changed dramatically. What typically is exchanged in lab meetings is already highly processed data, sometimes or very often even, in my experience, in the form of PowerPoint, ready-made PowerPoint slides that are sort of, figures on the way into a paper. I think that's way too late to exchange information. So I would encourage everyone to really exchange their primary data. Doesn't mean their raw data necessarily, but their primary data with lab members. Ensure you as a PI that you look at that primary data yourself. I have a really good anecdote on this. Actually, one of the really senior members, PIs here at EMBO in Heidelberg, Anne Frussi, she basically found one of huge scandals in her own lab, which led to retraction of a cell paper, essentially by just walking by a student and looking over his shoulder by chance and seeing that how he was basically faking data. And you know, that didn't crop up in any lab meeting and so on, because everybody's looking at sort of processed data at that point where you wouldn't see that sort of thing. So, you know, I think from an integrity point of view, but also from a point of view of criticizing the experiment properly and discussing the experiment properly, it's crucially important to share in the lab environment sort of what we call source data. And we have actually a platform at EMBO, which we developed based on our source data platform, which is called S-Dash, which is also allows you to share that in a sort of drag and drop way online. So that's a really good research tool. There's others too, and which brings us to sort of lab notebooks, because obviously we're not only talking about data, and it's very important to start immediately to say, when we talk about reproducibility, this is not just about data. This is also very, very importantly, including methods and protocols. They're really at the core of reproducibility, and it's almost the most important thing about reproducibility, I think, and they've really been forgotten. We're still living in this sort of era where we're going with free text discussions of methods, you know, free text description of the highly complex methods that you apply. And that's particularly important in biology because it is a complex science. We have huge number of variables that even in a highly structured way, we struggle to capture all the variables. I mean, you know, there's so many beautiful examples about this. If you do xenopus research, the moon cycle, and all these kind of amazing variables that you can't immediately think about. There's great examples. I always quote one with Cornelia Polyak and Mina Bissell, who were collaborating in the US across East and West Coast for years and couldn't reproduce each other's cell papers. And basically it took them a whole year to find out that one was shaking the bottle and one was stirring the cell culture. That was the variable that changed fundamentally if you got a finding or didn't get the finding. So you know, this is why it's so important to capture all the variables when you do your experiments. You're probably aware that there's some journals even that allow videos to be posted. So we allow that too, but there's even journals that specialize in that, such as Jove, a journal called Jove. I wouldn't necessarily encourage you to publish separate papers with video versions of your data, but I would encourage you to actually film complex and finicky ways to do an experiment. Also for sharing internally. So when you have a new student, for example, and the postdoc is just left, and as a PI, you probably don't know exactly what he did on the bench. It's actually great if you have a visual record and also structure the, you know, all the metadata you can get your hands on, temperature, the rotation speed of your cell cultures, and all this kind of stuff. And we do have platforms for that. So there is really good structured platforms online that allow you to capture this outside of journals. The one we collaborate with a lot is called protocols.io. They actually have a curation service, so they allow you to sort of help you to structure your data in a flow way to and sort of remind you to add the temperature if you haven't done it for a certain step and so on. So I would encourage you to start using this early on. So as you generate the data, already post your protocols. There's also a whole bunch of what's called lab notebook, electronic lab notebooks. I'd be very interested in your feedback if you're using these already, which ones you find very useful. I've talked to many PIs who started using it, and almost 80% stopped after some time and reverted back to cellulose-based writing stuff down. But you know, when you write stuff down by hand, you invariably will lose it. You probably can't even read the writing of your postdoc when they leave. They may leave with the lab notebook. It's just not a modern way to capture structured information. And maybe the final point to make is what's always forgotten too is not just the protocols in terms of describing the method you used, but a reagent management process. So one of the key problems is that people can't find the reagents. And just to give you one example, there's a huge issue with people mixing up cell lines. You know, this is this is actually one of the biggest reasons for unreproducibility is that people are using cell lines that are completely different to the things they think they're using, which is pretty shocking. But this comes from mislabeling, it comes from sharing reagents in a sloppy way, and these things perpetuate through the system. So basically, there is now digital standards to capture in a barcoded way information about exactly what lot of antibody used and so on. So I would encourage you to start using these sort of structured standards in your own internal archiving mechanism. And we as journals certainly encourage you to basically put these in your papers too, then that people can really track exactly what reagents you're using. So those are the key elements, basically data, protocol, reagents.
I think that was a good point you brought in. I think more of the time, this is a topic which most of the researchers are not comfortable discussing on an online platform or any open discussion in a meeting. I'm not sure why this is not, why this topic makes them so comfortable discussing, which they should openly discuss in order to figure out the answers. But since you brought up this point, research documentation is important, but I think the first place is having a very documentation about the reagents or chemicals in the lab, which most of the PIs really don't pay attention to. From which company are they going to get? And secondly, are they getting it from the same company, or is it from a different company the second time? Which also makes a huge difference when it comes to reproducibility. So moving on to the same line, Ankita has a question for you. Are there any specific guidelines or frameworks for research documentation in India as well as outside India? So do you want to share your thoughts on that?
So this is a very big question. There are indeed recommendations. So in fact, that's a good segue to plug my latest product, which is called ProMap. So we basically have come together now and this was sort of convened by the European Union actually, but it's was with the participation of global researchers. So we did have a big workshop that brought together scientists and journal editors and also platform experts to try to develop new standards for protocols and methods, how to share them. And that's called the ProMap standard. It was just released as a preprint. I can share the link in this chat in a second. And that basically calls out just a few basic principles just to sort of get us on the same basic line. And many of these will sound really obvious to you, but I think I found over the years, you have to start somewhere to get some sort of common standards going at a very low level. So at least you can agree on basic principles, because that allows then journals to start to ask for these things, to mandate for these things. And they have to be at a low level, otherwise everybody does different things and you never move forward. So we're trying to do this both at the level of protocols with the ProMap standard, we're doing it at the level of source data. So again, we developed standards that are starting to be used also by many other journals to start requiring posting of source data on every time you have a figure panel. We ask you to have a source data associated with that, and we provide you with a platform to actually share that information. So actually, it's quite exciting now. We're not doing slides, but if you go to any of our papers, you can actually see link outs to the source data underlying every figure panel, and hopefully it is almost every. I mean, there's still exceptions. This is all very much ongoing. But we basically have now what we call a data hub version of every paper. And this is a highly structured version of the paper that has, again, authorship and everything, but it's essentially based around the methods and the data. So you basically can click into any figure panel and you find the source data, you find the associated methods. You can basically zoom into the real data, you can reanalyze it, you can share it and work with it. So this is really this open data standard, and there are standards for that. The most famous standard, which Europe actually, and I think India too, is pushing for very strongly, is called FAIR, which means findable, accessible, interoperable, and reusable, which is a really high standard to meet formally. So we are sort of saying FAIR is really hard, but it should be as fair as possible, basically. With human data and so on, there's all kinds of complexities around that. But essentially the same FAIR principle applies to protocols and methods, essentially. So you should share your protocol in a way that is findable, that's accessible and reusable. So, and this is why we're now mandating for certain papers, we mandate structured methods sections in our journals, and we're strongly encouraging for now, but again, your feedback is really valuable here. We're encouraging you to have protocol versions of your papers in a platform such as Protocols.io, which we deeply interlink with bidirectionally. So do you think we're ready to mandate protocols? That's a question I would throw at you. Or is this where you would say, come on, this is ridiculous. It's now so much extra work. But that's what the ProMap standard is proposing. It's basically saying every paper should have a protocols version of the paper. What do you think?
Absolutely. Well, thank you for bringing up that point, because every time I call in for a lab meeting, ask the research scholar to bring the protocol, then go over the protocol, parallelly check with the result. I know they feel bad about it. It's not like you're doubting. It's more like giving them a reconfirmation that, yes, you have used the right protocol, right chemicals, and yes, the result is the same. So that reassurance and confidence that you keep insisting on the research scholars, but yet a 10 minutes meeting goes prolonged to 30 minutes meeting. Probably young researchers like us, if we start building on this sort of a habit, we are not going to complain later on. But I think before moving on to Sachin, who has a question, who has to be unmuted, I would just like early career researchers, if you want to have a question or talk with Bernd, post the questions here. What are the difficulties that you're facing in having the research work documented? Do you feel short of time? Or, mentoring takes a lot of time. I agree upon that. But then doing science right is also as important as you publish. You have to cope up with the competition which is going on in the field, but that doesn't mean you can compromise documenting the data, having it right. Having one publication right is important than having 10 publications which may end up in, at an early career stage that may end up in a problematic issue. So
I think that's a good way. So sorry to interrupt, but I want to comment on that point. I think you put this extremely well, Divya, and it's actually pragmatic to do exactly what you just said, because it's not just to do it the right way, which is important. I mean, we should never forget we're paid by taxpayers to do a public service, essentially. And I think this also gets at the point who actually owns the research that we do, right? I mean, traditionally in Europe and the West, there's this sense, oh, it's mine. I have to. This is my property. It's my intellectual property. To some extent, it's true, and I don't know what the Indian regulations are, but certainly in the US, for example, if you're publicly funded, it's not yours at all. Actually, even legally, you're generating public data, so you have a mandate to share it in a way because it's not yours essentially. But I don't know what the Indian stance is. In Europe, it's a bit more complex. But the point I really want to make is it's also an investment in your future. So your reputation is hugely important. Every time we end up retracting a paper because it's not reproducible, even if it's not for reasons which is really important to emphasize, it's really often not for reasons of misconduct. It's just because it turns out to be not reproducible. And that's still damaging reputationally, but it means you invested a huge amount of human resources. Your postdoc, they may only get that one paper. Their career will be massively affected by that, even if yours is not so much affected. So when I talk to people that are starting to use these lab notebooks and management process in a structured way, and I have one example from Germany's biggest hospital, the stroke unit in the Charité in Berlin. They have a unit of about 120 researchers, and they actually hired 2 professional data managers and resource managers that help the PIs to structure the information, both at the level of reagents, at the level of protocols, and also they help then writing the papers in a structured way, including the protocols. And they claim just those 2 salaries are actually more than the money. So it's a profitable investment because they save so much time in not having to find reagents for 3 months once a postdoc left, in having papers that are more reproducible where less issues crop up. They feel it's actually just pragmatically a sensible investment, not just to do the right thing. It's just it saves them a lot of effort. So if you're in a slightly bigger institute in India, I would encourage you to think about these things too. It's not just the electronic tools. It may also be useful to think about investing in professionals that actually, that, you know, their focus is really on structured data and structured protocols.
Okay.
Can I ask
Sachin,
something?
yeah, Sachin, please.
Once we have done our experimentation, then we have data. So how long do we need to preserve that data? Is it like before, unless and until it is published? First question. Second, up to what level of privacy, that I have generated that data, I have done those experiments, so I need to keep it up to me, so it doesn't go in wrong hand, like some people can replicate that experiment before me and it can be scooped out. Yeah. So up to what time frame should I be keeping it up limited to me, and those protocols also? So those
yeah, I think Bernd, this is one thing which I think this is about this point of having that fear of sharing the data is also a point why people don't openly discuss about research documentation. So that fear of getting scooped, or that trust among the researchers is not yet built up.
Yeah, no, I completely agree, and that's not just an issue in India, of course. I mean, so there's three things you mentioned which I should answer. So one is the time period, the other one is the human data, and so on. So there are certain data types which may be more restrictive for sharing, of course, and maybe protocols associated with that too. And then the third thing is the whole dynamics in the system, which sort of discourages sharing. So the problem in biology is it's very easy to replicate work in principle. I mean, it's hard because we see that only 50% is replicable, but it's fast to do it once you know what to look for, right? So this is why it's so fascinating when I discuss these topics, and this really started when we started to push preprints very strongly. In biology, there was a huge reluctance. We got this idea from the physical scientists, where this has existed for 30 years, essentially, preprints. And we talked to them, and it turned out the person who invented the preprint concept in the physical science had never heard of the term scooping. In physics, it just didn't exist, basically. So it does exist now in certain areas like material science, where it's a very dynamic process too. But it's so interesting that really surprised me. And the reason is, of course, often these things are done in a highly collaborative manner. Think about astrophysics or particle physics. People using all the same machine, and it's just by design collaborative. In other fields like mathematics, people are working very much as individuals. You don't really copy each other. It's a very different structure. But interesting is also to think about things like computer science, which is based on a much more collaborative way to design, if you think about GitHub and so on. So even in competitive fields, these things have emerged. In biology, it hasn't. And the question is why. And this really brings us back to this research assessment thing, which in biology is so focused on getting your paper out first, on being the first to goal and getting into certain journals. So we have a couple of policies that, again, I'm really happy to see become standards. So just to give you one example, we just have a policy that you can't be scooped. So once you post your preprint, you essentially, we will not reject your paper if something else comes out in the meantime. And that's something that is a risk for the journal, because the journal also loses priority in a sense. But if everybody does it, it's a level playing field again. And that's what we need by framework. We have to have certain new standards that we all agree on that will flip the system. And I totally understand the reluctance to share your methods fully, because it opens it to everyone. And they can basically do the experiment really fast and get the same data. So, but that's the whole purpose of sharing your science with your colleagues. It's really important to be clear that you also see, and there's a net benefit because you see all the open science of all your colleagues too, which allows you to do your science better too. So, if everybody plays at the same level, the system is balanced again, and your competitive advantage is exactly the same, because you benefit from seeing other people's work, they benefit from seeing your work. So I think it's all about leveling the playing field, and that's why it's so important to have standards which are implemented broadly. And the entity, and that's something we did very early on with the San Francisco Declaration, and we did now with the ProMap standards, that we basically have guidelines for all the stakeholders in this. So we have separate guidelines for the funders, for the research institutions, for the scientists themselves, and for the journals, because they all have to move in lockstep to change the system, basically. And the thing that's typically, in my view, missing is the funders. So maybe that's something to note for India Biosciences also. I think often the funders say, well, we don't want to steer stuff top down and stuff. Let the journals handle this. But as journals, we would say, we're so downstream, we can't, once you've done your experiments in an unstructured way, if we then mandate it, you have to go back and start from scratch. If you didn't archive your protocol and we suddenly say you must have a protocol, that will kill your paper, essentially. So it really should be your research institution and your funder who starts you out saying, we're going to give you these tens of thousands of dollars to do the experiments, but we require that you do it in a structured way. And once you are ready to share it, you should share it in a structured way. So I think that's why we have this approach of doing guidelines for all the entities at the same time. And the thing I forgot to mention is the human data thing. So there are, of course, certain data types where you cannot easily share everything completely openly. Methods are generally different because they should always be shareable, but the general policy, at least in Europe, the way FAIR is framed is you should share as much. I can't remember. There's a beautiful way to frame it. You should share as much as possible. Under the guidelines. There's a better way to frame this. I forgot now what the saying is, but there is, of course, an appreciation that you can't openly share everything that you get in real time. For basic science data types, that should be the standard. And there's beautiful stories, as you know, from the Human Genome Project and so on, where this 24/7 sharing really accelerated the process and benefited everyone ultimately. To the extreme of medical science, where often human data cannot just be shared completely openly. So, but there's frameworks for all of these things. Depending on your data type, there's typically standards you can go into. The journals. At our journals, we typically have in the guide to authors a structured way where you can access the relevant standards. If you're missing stuff, please let us know, because this is always a living document. Oh yeah, as open as possible and as close as necessary. Thank you, Priscilla. I just saw that. I forgot how. Yeah, that's the way to say it. As open as possible, as close as necessary.
I think Mayuri has a question as we're talking about the FAIR guidelines. How is reusability defined? Do you need to just share the protocol or a proof with the other scientists to reproduce it? Yeah,
that's a really good point. Generally, when we say, for example, we validate data in peer review, it's actually the wrong word. So we obviously don't expect pre-publication validation of anything. What we expect you is to share things in a way that in principle somebody could go in and use that information to redo the experiment in a way that would lead to a similar result. So we certainly would encourage people to reproduce more, but we don't expect reproduction. So I hope that answers the question. If it doesn't, let me know. It's an interesting topic. Actually, one thing I also want to mention in that respect, as a strategy, as a PI, I've talked to some PIs, and maybe these are often more senior people on bigger consortia, but something to really think about, because biology is so finicky and there are many variables. And I had this myself in my own research career, where you simply can't reproduce your own experiment suddenly, and you don't know why. You get desperate and you try. I had a really exciting finding in the early days of ubiquination. I just simply couldn't reproduce it. And later other people published this stuff 5 years later, and it was actually a real result, but I couldn't reproduce it myself. So I would strongly encourage you within the lab to start with. If you have an exciting finding, get another postdoc or student to try to reproduce it themselves. So independently. That may be with the authorship sensitive, so pre-discuss it. They may not become first author then but it's really worth doing, because often things are complex and they're not always easily reproducible. And then I've talked to people that do this in consortia too, because often it's, when you change, there's famous examples in stem cell research where changing the tap water changed the experiment, basically. So if you're in a consortium and you have a really exciting finding, reproduce it across your collaborating labs too, before you publish the paper, and then report that. That's really makes it much more solid. So if I, as an editor, see that this, this level of work was done, that level of reproducibility, we're obviously very positive about a paper like that.
Yeah, I agree, because I've experienced this firsthand, like just the pancreatic islet isolation from the mouse. We changed the buffer. Initially, we got the buffer from Sigma, and then we got it from Thermo. It's not the company specifically, but the way the protocol is being followed, be it incubation time, the way you vertex the sample, all such minute details, which the people who's working on the bench would feel is very simple, do make a huge impact on the outcome of the result. So every time when the person comes in, I think it's ideal to make them write the protocol rather than you give a already established protocol from the lab, which has helped me as an early career, because when the person comes in, I ask the person to observe and then prepare a protocol. And then we sit together, discuss with the already defined protocol, and then hand in hand check with the person where he goes wrong, the way he vertex the sample, the incubation time. Sometimes you feel I can leave it on the bench for 20 minutes and then come back, which is not right. So those little activities would make a huge impact. And then you say, I've done the right way, and still the results are not the same. So those little minute things which need to be discussed within the lab meeting, and all such things I think needs to be discussed openly, not to take it personally and get offended, which is very important when you sit together for a lab meeting. So again, this is the culture of the lab.
No, that's a great point. So the last point you made is particularly important, I think, an open lab environment, right? So where it doesn't look like your failure if you can't reproduce something, you should just be open about it. Because often it's things that are simply unexpected and things you can't easily pinpoint. And I really like the way you go about trying to pinpoint the variables that you've missed. Basically, that's a great way. I would really encourage you also to when a student starts a new experiment, that they already write down the protocols and that you archive that. And every time you do the experiment, you archive it against the right version of the protocol. Protocols are living documents. That's also one of the strong recommendation in these ProMap standards, that we say protocols have to be versionable, so that you basically can update them and change them. And then you should always refer to the version of the protocol you used for a specific experiment that you actually published.
So there's one question from Ratnesh, which is very relevant. How has the transition from traditional paper-based research documentation to e-notebooks impacted the efficiency, reliability, and productivity of researchers?
So that's a really open, that's a really ongoing thing, and the jury is a bit out. I would say ultimately it will be a very positive impact. So both at the level of the system overall, I think if you just briefly think, if it's really true, let's assume it's not 50% is not reproducible. Let's just assume 10% is not reproducible. If you just calculate the billions of dollars invested at the systems level in terms of financial terms, but also in terms of postdoc careers, you have only one shot at goal as a postdoc, and if you invested in an unreproducible piece of information, your career is essentially terminated. All this investment in training you and so on is gone. So we're talking about billions of dollars. So at the systems level, I think it's a no-brainer to invest a bit of extra effort to do it. At the individual level, I think it's going to be interesting to see how the extra work it takes to set up your platforms and so on, how they impact you. Again, I can only report from people that have done it. There is a group of people that tried and gave up. So in Europe, I talk to people all the time that tried and have a good faith effort. Typically, it's the PI who tries to push people to electronic lab notebooks and then say, the problem is that they're not bolted on in a constructive way to manuscript submission systems or manuscript authoring systems. So actually it added friction. It didn't reduce the friction. So we gave up. So we went back to paper. But the few people that persisted really report later that once they have a good structure in the lab, they have massive efficacy gains. So I think overall what's really missing, and we're trying to have these conversations much more, but we haven't nailed this yet. But basically once we have a standard for methods sharing and so on established, we will talk much more to the platform providers, and we are talking to Protocols.io, for example, in how far we can integrate the systems, so that essentially once you have a protocol ready, it's a click of a button, you associate it with the figure panel in figure 3A or something. You know, it's the pre-existing protocol which you already posted way before you did the paper. And then all you have to do is to associate it with that figure once you publish your paper. That's what we need to get, and we're not quite there yet.
Aditya has a question, and I think this is often debatable. Can alternative ways, because most of the time, research reproducibility is always closely connected to productivity. In order to be productive in a lab, which is always on par judged with the number of papers you are producing in the lab, so that is how people judge you, which is not the right way. So the impact factor, the number of papers that you are going to produce in that during period. So how are you going to assess research output, helping more research reproducibility? What are the alternate ways? So this is always a debatable question. We still have no answer for it, but still, I think it would be great if you can share your thoughts upon that.
Yeah, no, exactly. I think this gets really at this incentive issue. So I think that it has to come from multiple ways. I can tell you that from the journal side, what we've been doing to help this. But again, I really emphasize the funders and research institutions also have to encourage it and even mandate it. So that basically, yes, we want you to publish high impact papers, and that's great. But we also want these papers to be reproducible, and we will assess you actually based on that. So, you know, if you're going for tenure, we will actually look how your record is, you know. And I think, you know, I would extend this even to the point of saying, if you're self-correct, I mean, this may be now a little bit of a tangential point, but we're really trying to encourage self-correction of the literature too, where people, so we're trying to, we have a much more complex set of corrective mechanisms now than just retracting or correcting a paper. So we're using different terms. If you self-correct your paper, for example, we can do self-correction at a very granular level, not the whole paper then being labeled in PubMed Central as corrected, which is sort of off-putting. You can micro-correct papers now in a traceable way, but that's really sort of lowers the bar, the friction, and because reputationally it's, you know, it doesn't have the same footprint. So that's one of the things we're doing at the journals. We're really making it much easier to self-correct. And ultimately, from the institutional side, I would really hire somebody who self-corrected several times, because it shows they're engaged. It shows that they really care about their own work. So, but that still has to sink in with the research institutions, right? Another thing we're doing at EMBO Press, I'm chief editor of EMBO Reports, and we are actually strongly encouraging papers that show reproducible science. So we call this first replication studies, because often, of course, what happens is that you replicate something, you put a huge amount of effort in, and either it works out, in which case it's great to get a pat on the shoulder as the postdoc and say, well, you can't publish this, it's just nice that it worked. So we are encouraging for important findings to submit these papers to high impact journals such as EMBO Reports, because then you also get credit for it. But we're also encouraging, if it didn't work out, if you get null data out of it, or even refuting data where you get the opposite result, we're encouraging those papers too. Because those are really hard to do. You know, if you don't get a finding that is published, so then you have to do all the kind of control experiments and so on to work out why it didn't work. And in the best cases, you actually understand why there's a difference. Maybe one was shaking, one was stirring, right? So, and that really has to be rewarded. So as a single journal, we're now encouraging those papers. I think others should start doing the same. Of course, we have to be careful that if you publish thousands of these, then, you know, our own, we're also in a competitive landscape as journals, and people come to us because they feel we are enriching for this exciting science, and we don't just want to publish all the replicating pieces of data that are out there. So we're trying to do it for the really important ones, but we're encouraging it. So that's sort of one very simple thing that journals should be more open to, I think.
Yeah, I think that alternative sounds good. So having negative data published probably is one of the alternatives that we should be looking forward to, you know, cut this competitive race which is going on, which is totally unhealthy. So what are the challenges that you face integrating reproducible research practices in life sciences, especially?
Yeah, I think the life science, I mean, we talked a little bit about the speed. I mean, the life sciences, so there's two elements. One is life sciences are inherently much harder to reproduce because these are highly complex systems. It's very different to physics, where you're looking at absolute facts, basically. In biology, we have a ultra complex system that's barely understood typically. So that also implies that we don't understand all the variables of what we're doing. It's sometimes more like cookery, it seems, that, you know, than doing physics experiments. So, which is not derogatory. I mean, that's how biology is. It's exciting because it's so complex, but so much more reason to document exactly what we're doing. You know, that just shows the onus is really on us as in biology to do this in a way that's reproducible. But the other question was, what was the, sorry, I'm digressing a bit.
I think this one was I talking about the global guidelines and how long do I need to preserve my raw data post publication.
Oh yes, we didn't discuss that very important point.
Yeah,
Yes,
that's
thank you for coming back to that, Neha. Yeah, so traditionally, and this is a really soft number, traditionally it's 10 years. Now that's just a random number that's sort of almost consensual because it sort of emerged from the history of time. I think the reality is it should be infinite. So basically for most data types, so it's important to say what data types. For small data sets, there's absolutely no reason why you should not build into your lab management process a way to preserve forever your data. And I would even encourage you for small data sets to preserve every piece of data you generate. So many institutions in Europe, for example, the Max Planck Society now requires that every experiment you do in the lab is preserved in the institutional repository. It doesn't matter if the experiment didn't work or not. It's just there with a timestamp. You know exactly when something was done, and you can go back to it. And you know, storage is not a problem anymore these days. Of course, this doesn't apply to high resolution, you know, high density imaging data and stuff where you can't even preserve it for 24 hours. You know, you have to. So you have to be pragmatic. In those cases, of course, you preserve the process data, you preserve, you know, the data, but minimally aim to preserve all the data you're aiming to put in a preprint on a database or onto a paper, preserve that really forever. Because we have so many tragic cases where issues arise, let's say 12 years after the paper was published. Literally every day I deal with cases like that, where we go back to people and say, well, this looks surprising, you know, maybe there's a duplicated panel in the image or something that was only found 10 years, 12 years later. We need to sort this out. So what actually happened? Was this a mistake? Was this, you know, we need evidence this wasn't intentional. And if you can't find your source data that is sort of compelling, and we have a problem, and we will end up retracting that figure. So you know, this is why it's really worth investing a bit of effort also at your institutions to set up infrastructure that allows you to store data in as structured a way as possible forever, essentially. So I don't know, it sounds a bit dramatic, but I think we're, you know, the infrastructure is there that we can do this.
I think this is something which we are facing on a daily basis. Like since one paper, you have tons of images follow. What we follow in our lab particularly is after publishing, we have one image which is published and delete the rest of the 20 images you have taken, because it's very difficult to save the images which you have taken.
Exactly. So yeah, just to, sorry to interrupt, but just to be clear on this. So our source data policy, which I mentioned, which is to say you should have source data for every figure panel you publish. We actively encourage you to post all the replicates with that
yes.
too, which obviously makes the data much more interpretable, meaningful also, because suddenly your Western blot, you have 5 Western blots, you can even look at the quantitative elements there, even if you don't cover them in your text of the paper. And we basically give you free space to host that, because we're part of the European Bioinformatics Institute, and we have a platform there called BioStudies, which has infinite storage space. So we basically give you all of this structured storage space for free, essentially, when you publish your paper.
Yeah, that's right. Because when we take IHC images, for instance, we take 20 images, let's say, and then we can pick the best of the images, which we store only 4 to 5, and then delete. But as researchers, we become so conservative or so much into our data that you start saving each and every bit of it, and then start complaining that there is no space to save the data. And then that also causes a problem later on. If you have the other papers coming in, you'll have 100 figures where you actually get confused finding the right image. I've seen
Yeah.
people messing up with that. And when the raw data is asked, they don't know which data to give into the journal.
Yeah, so that's the last point you made is actually the source of many of the duplicated image issues we have post-publication, that people, it turns out there was really no misconduct. It was really
That's right.
a fusion of the tags. And as we generate all these masses of data, so that's really one piece of advice, just have a good management plan on ensuring that your metadata is really well preserved with the images. In a traceable way, because that leads to a huge mess. And we see really literally every week we see a case like this, and it's really heartbreaking, because many in the community immediately jump on the assumption that somebody's cheating, and it's really often more often than not the case. And on the point of the posting, of the cherry picking point that you made, I think it's true that you're really into. So we call this the rosy colored glasses effect. It's again, people are not actively cheating well, some are, but typically not. But it's just you've invested so much effort in your own data, and biology is so messy and complex that we often get tiny effects, and we just know from experience. Even statistics don't really give you a clear answer, but we know from experience there's something there, and then we pick out the one that shows the most dramatic result, just to show to the world that we're onto something, right? But this can very quickly mislead, because if others repeat the experiment and they see, 1 out of 10 times it only works in half the amount that you reported, suddenly they will suspect that you are misleading. So, we really try and it's easy for me to say this, but we really try to send a message that we understand as editors, biology is complex, and we want you to report it as you saw it, not some beautiful story about what you saw, but we want you to report your proper data. So
that's a valid point.
This is another point. It's difficult, and we all understand that we want to tell hot stories and in a compelling way. But you also have to be self-aware that there's a very strong tension there, and it's very quickly to be dragged into misleading what you actually found in the lab.
That's right. I think that leads to the last point of discussion as we are coming close to end the session. So how does tying research documentation with research ethics is something which is important. So could you please share your thoughts on that?
Yeah, no, that's really, thanks for asking the question. I think it's really important. So often, so there's a huge problem with research integrity things. I mean, just to give you one number, we are screening for image aberrations systematically at our journals, and for many years we're doing this now for decades, and we used to see about 15% of issues post peer review so papers that are ready to be published. Now we're seeing about 10%. Of issues, but this is a huge number, and this is just at that level. And there is a huge problem that people are conflating reproducibility with research integrity and with ethics. So these are three different topics. The ethics would apply, for example, are you reporting the data as you found it, essentially? This last point we made, that's the sort of ethics question. Integrity question is, did you manipulate your figures in a way to misrepresent, or did you even invent data? And by the way, I just mentioned the word artificial intelligence here, massive issue. So be very careful when you use AI for stuff. It's very, very easy to deepfake data now. It takes 10 minutes to generate Western blots if you really want, without ever touching a bench. So it's a real issue, and just be careful also with your students that they don't start playing around with tools that they don't really understand properly. Of course, you can use these tools to process information, but be very, very careful. So that's what integrity is. And then what we talk about here is reproducibility, which in my view, the much more important problems are the structured reporting of protocols and methods, the structured reporting of data associated with these methods. If we solve those two issues properly, I think we've solved 80% of the reproducibility issue already. There's a small fraction of integrity issues, which are very tragic and important, but we should not conflate those topics.
Okay. So as we are coming close to the session, I think the take-home message is this: spend more time with your research scholars or the lab people whom you're working with. I think looking back to the raw data is as important as you see the beautiful images which you are ready to put out for publication. So that's very, very critical. Refer the raw data, analyze it, sit with them, make a point that everything is clean and clear before you put it out for publication. So your integrity, ethics, publication, everything has to be done on a right way in order to successfully lead a career, especially early career researchers where the field is challenging and you have to build a very strong career, but based on a solid research ethics. So thank you, Bernd. Thank you so much for being with us today.
Maybe think just to add to this, maybe, and I see there's one more hand up actually, but maybe just to add, so when you choose a journal, I would also encourage you to choose journals that give you mechanisms to archive your data, that give you mechanisms to store your protocols and so on, because you should see this as a service provider basically, and once you've deep archived things with the journals, you can also always go back to it. And it's really meant to help you. So if journals are not ready to engage with this to cut costs or whatever, I would say maybe you should pick and choose to do science properly.
Yes, and Bernd, you correctly pointed out Sachin had a question, Divya. Maybe Sachin, a quick question because it's 5 p.m.
Yeah, thank you. Is it ethical to use AI-based tools to paraphrase some of the research papers findings to incorporate it as a review of literature? And is it okay to use ChatGPT and all those platforms to further fine-tune your research paper or your manuscript preparation?
Writing. Sounds good. Thank you, Sachin.
Yeah, that's a good question. So we've just released an AI policy. I hope it's live because we literally just did it. I can share the text with you afterwards if you want to share it with the group. Basically, yes, it's completely fine to use these tools, but you have to use them as tools. So we ask you to declare that you did that. So in the method sections, it's really like using a certain microscope. You're using this sort of AI tool. And just be very careful that you understand the provenance of the information. So you are the human author of your paper. You cannot use an AI as a co-author. We don't allow it, and you should not think of the AI as being a co-author. So basically, you as the human are in control of every word you write. So you can use your tool to smoothen the text, to improve the readability, and to even generate ideas. High-level AIs will help you with that, which is dramatic. That's okay, as long as you know that they didn't take the idea from somebody else without attribution. So you have to do the background research. Where did the AI actually get this crazy idea from? It's an amazing idea. I can't find it on PubMed, but it must have come from somewhere. So, you have, it's up to you. Like you would talk to your postdoc, you would probably ask them, where did you actually find this from? So it's up to you as the senior author to be in control of every word you write and every piece of data you show.
Yeah, I think Sachin, now few journals have that option to click in whether you have used the AI tool for the publication process. So there are defined guidelines that you have a list of things that you go through and then make sure you have followed that and then click the button. So it is a tricky game.
So read the instructions of journals because they have slightly different guidelines. They're a bit more extreme. So just be a bit careful. By the way, maybe one thing I could mention is for methods, that's another little policy that journals can do and should, and that's also recommended by ProMap. So we've dropped the requirement not to the plagiarism screen does not apply to method sections, to put this simply. So basically, because there's so few words you can describe a method in, we're basically encouraging people actually to reuse words and just reference the source of where you got the method from. It's typically your own paper, your own previous paper, but just say, as we showed there and there. Don't use shorthand citations so of course you can use a reference to your previous method, but make sure you add all the changes that you made to the method in your new paper. So what we see a lot is that people use shorthand citations, which don't allow you to recreate the methods exactly. So it's fine to cite. In fact, you should cite when you reuse blocks of text, or you don't have to reuse verbatim exact text, you just cite it, but you have to add all the changes to the methods that you used in writing. Just think about it as an external author, a scientist who's trying to replicate the work. Would you be able to do it yourself? Sorry, going
absolutely.
on.
Thank you, Bernd and Divya. This has been quite the session, and we can go on and on. Except for the fact that people need to move around when they're sitting. We could do these huddles for 2 hours at a stretch. But that might cause a different set of problems unrelated to reproducibility.
Yes.
Thank you, Divya. The questions were really pertinent. They were also stemmed from your own experiences and anecdotes while running a lab. And thank you, Bernd. You have a wealth of experience and anecdotes to share with us. I'm sure we will circle back to this conversation via India Bioscience, maybe through an article or a longer sort of workshop. We could circle back to that, especially we could get a little more from the community as to how the challenges with using the tools and where they want to see this going.
Yes, exactly. This is the function of India Bioscience, maybe to sort of aggregate this sort of feedback also, and please send it to us because we want to be responsive also to your needs. Yeah.
Thank you very much, and have a good rest of the day, Bernd. It's Friday afternoon. And yeah, I think we'll call it a day call it a week for the weekend right now. So thank you, Bernd. Thank you, Divya. And thank you to our young investigators who joined us. And
bye-bye.
Take care. Thank you to Team India Bioscience for all the work behind this meeting. You can see several of them in the meeting room. And maybe we just take a screenshot. Maybe we do that, Shweta. Can we take some screenshots? Sure. All right. Yeah, I'm taking them. Yeah, thank you. Hi, Vijeta. That's commitment right there.
Joining from inside a car.
Whatever works. Thank you, Vijeta, for joining us. Thank you, Team India Bioscience, Ankita, Aditya, Shweta, Vijeta, and Manjula, who's on a day off today, but thank you all. So see you around next month. Different topic, same people. We look forward. Take care. Bye-bye.
Thank you. Thank you. Bye-bye.